Yeah. So I think they'll be interpreted differently in different countries. So for example, in the UK, at the moment, for us to give the immunotherapy, we have to say we're going to give it for 2 years. So now the conversation that we need to have with our commissioners is whether we could actually stop at a year and then restart again. Whereas in other systems where the patient is paying for the immunotherapy, that may be a very different conversation, with their clinical team saying, okay, we could stop now without at 1 year without too many problems. So I think every country will take this information differently. They'll also look at other data that are coming through. So there's a Canadian study called the stopgap study that will eventually read out that's treating until best response and stopping then and seeing if you then need to restart again. So I think that will be put into the mix too, and we're talking to the stopgap team about how we can analyze our data together. And there's other trials going on in other tumor types as well. So there's other strategies. So not just reducing the duration of treatment, but also maybe the dose of treatment. So there was some really interesting data presented at ASCO about giving low dose immunotherapy in an Indian study called the SARI study. So I think all of those things need to be looked at together. And then guidelines produced according to that. But I think it's created a lot of interest, and what I'm of course also doing is talking to the drug companies about how we can take that forward, because duration questions aren't going to go away, so we need to carry on doing research in this area.